Most adults believe that vaccines are important. We have learned that from research. Yet most adults are not aware that they need vaccines throughout their lives to be protected. Many adults, including healthcare professionals, do not get the vaccinations they need. The result is that each year, thousands of adults in the U.S. suffer needlessly from illnesses, hospitalizations, and deaths that could be prevented. To improve adult immunization rates, the National Vaccine Advisory Committee published a set of recommendations called the Standards for Adult Immunization Practice. The standards call on all healthcare professionals to take steps to make sure their adult patients receive all of their vaccinations. The standards are not just for providers to immunize. Even if you do not administer vaccines, you play an important role in recommending needed vaccines to your adult patients, whether you work in a clinic, a pharmacy, or a hospital. The standards recommend 4 steps you should take to make sure your patients are fully immunized. First, assess your patient's need for immunization at every clinical encounter. Influenza, tetanus, Tdap, zoster, and pneumococcal vaccines are routinely recommended for adults. Your patients might need other vaccines too, based on their age, medical conditions, occupation, travel plans, or immunization history. Remember, adults believe that vaccines are important, but many are not aware of all the vaccines they may need. Second, strongly recommend the vaccines your patient needs based on your assessment. Your recommendation as a trusted healthcare professional makes a difference. Even if you do not actually provide immunizations in your healthcare setting, your recommendation still matters. Third, administer needed vaccines or refer your patient elsewhere for vaccination. Access to vaccines is expanding in many communities. In addition to physician offices, many pharmacies and workplaces now offer immunization services. Be aware of the practices and locations in your community that offer vaccines. The fourth and final step is to document the vaccines your patient received in their medical record and were available in the state's immunization information system. These systems, also known as vaccine registries, are confidential databases that keep records of which vaccines were administered. You can use a registry to keep track of the vaccines you have administered to your patients and to see which vaccines your patients receive from other providers. Implementing these 4 steps, assess, recommend, administer, and document, can require changes that may not seem feasible for your situation or practice, but there are a number of tools available to help you implement the standards, as well as educate adults on immunizations they need. For example, CDC has a website with information on the standards for you and resources for your patients. We know the standards work. We have the data to show it. A great example of successfully implementing the standards is the work of the Indian Health Service, or IHS. Consistently using the 4 steps in the standards has resulted in vaccination rates among IHS patients that are significantly higher than national rates. We asked Amy Groom with IHS in Albuquerque, New Mexico, to describe how they implemented the standards for adult immunization practice.
The Indian Health Service, or IHS, is the federal agency responsible for providing health care to approximately 2.2 million eligible American Indian and Alaska Native people in the U.S. Services are delivered through a network of IHS, tribal, and urban Indian healthcare facilities in 35 states. Healthcare facilities in the IHS network range from large hospitals and outpatient facilities to clinics in remote villages. While the specific population served by IHS is unique and some of the facilities are remote, IHS is similar to many managed care organizations and healthcare systems. Like other systems, IHS is a network of facilities across a geographic region, staffed by different levels of healthcare providers working within a budget. In addition, the standards of care and the tools used by IHS, such as electronic health records or EHRs, are similar to those used in other healthcare systems. IHS has been able to achieve adult immunization rates that exceed the national average. IHS has achieved these rates by customizing its EHR to include provider reminders for vaccines that are due, facilitate recall of patients if needed, and monitor immunization coverage. In 2014, coverage of ever receiving one dose of pneumococcal polysaccharide vaccine among those 65 years and older was 89.8%. IHS policy supports the implementation of the CDC's Advisory Committee on Immunization Practices, or ACIP's, Recommended Adult Immunization Schedule, and the National Vaccine Advisory Committee, or NVAC's, Standards for Adult Immunization Practice. The standards outline 4 evidence-based strategies for providers. They are to assess, recommend, administer, and document. The first strategy is to assess the immunization status of all patients at every clinical encounter. Clinical decision support is incorporated into the IHS EHR for all of the ACIP age-based immunization recommendations. This makes it very easy to assess which vaccines are needed. As ACIP recommendations are updated, they are incorporated into the IHS EHR. Healthcare professionals should stay informed about the latest immunization recommendations. Nevertheless, busy providers also need convenient and easy-to-use tools to review patients' vaccine needs and remind them when vaccines are due. Having the reminders in the EHR allows them to easily incorporate vaccination assessment into their workflow.
As a healthcare provider, I try to stay informed with the latest immunization recommendations, but it can be challenging. Having immunization reminders in the EHR is helpful because it allows us to easily incorporate the vaccination assessment into our workflow. I check the EHR as part of my pre-visit planning for each patient to see what vaccines are due. When the patient arrives, the nurse also checks the reminders and notes what shots are due so that I know to go over that with the patient.
The second strategy IHS implements is to strongly recommend vaccines the patient needs. Clinicians are the most valued and trusted source of health information. Research indicates most adults believe that vaccines are important and are likely to get them if recommended by their healthcare professional. And while many adults are aware vaccines are important, many are not aware of the vaccines they need.
As a part of every visit, I go over with the patient what vaccines are due. Often my patients are not aware that they need vaccines. If the patient is reluctant to receive one or more vaccines, I try to address their concerns and provide additional information as to why the vaccine is important.
The third strategy IHS implements is to administer needed vaccines. Standing orders are utilized so eligible nurses, pharmacists, and other healthcare professionals can administer vaccines without a physician exam.
It's really important to reduce barriers to receiving immunizations. At our facility, we have standing orders in place for all recommended vaccines. This means patients come in and receive vaccines they are due for without having to make an appointment with a provider.
During influenza season, many of our sites use their pharmacists to provide walk-in influenza vaccines at the pharmacy or another location in the facility. Some sites have even expanded pharmacy-based influenza immunization clinics to cover other vaccines, such as pneumococcal, zoster, and Tdap. The final strategy IHS implements during every vaccine administration encounter is to document the vaccine in the EHR. This ensures that clinical decision support can accurately identify vaccines that are due. Documentation in the EHR also enables providers to use the tools in the IHS EHR to monitor immunization coverage levels, generate lists of patients who are due for a vaccine, and print reminder letters. Many state immunization information systems offer similar tools, which is why IHS works with states to electronically share immunization information.
I think the process we have for vaccinations at IHS could easily be replicated in other practice settings that have an EHR. The provider reminders we have in the IHS EHR are probably one of the main reasons that vaccine coverage among our adult patients is so high.
Adults served by IHS tribal and urban Indian clinics have higher coverage compared to the general U.S. population with most adult vaccines. We have achieved this by leveraging existing systems such as our EHR, to assist providers in assessing patient needs and reminding them and their patients when they are due for vaccines. We have also expanded access to vaccines in the facilities by implementing standing orders and walk-in and pharmacy-based immunization clinics, all of which makes it much easier for patients to get recommended vaccines. While all of these strategies take commitment, many can be easily implemented by most healthcare systems and providers, and the benefit, protecting adults from serious and life-threatening vaccine-preventable diseases, is worth it.
You can use strategies similar to those of IHS to implement the standards in your own practice. Actions as simple as assessing and recommending vaccinations can have a tremendous impact on protecting adults in your community from vaccine-preventable diseases. And remember, healthcare professionals need protection too. Your recommendation to your patients can be stronger if you have been vaccinated yourself. So make sure you and your colleagues are up to date on your vaccinations.